Hi, everyone. For my fieldwork project, I wanted to explore how patients in an institutionalized setting experience COVID-19. I did this by creating a patient COVID questionnaire that asked 5 open-ended questions. This was available to all patients on the Rochester Regional Forensics Unit. Each patient was given 1 credit in the PEP system for completion. 8 responses came from G1, however, 2 were discarded due to lack of legibility. 4 responses came from F1, and 9 responses came from F3. That created a total of 19 responses. I first asked, how did you first hear about COVID, and what were your initial thoughts? Some themes that I found were that they heard about it from the news. They were concerned for themselves and their families, and there was some denial about the severity of the illness and if it would spread to the US. Other responses include that they heard about it on the radio, were unsure what to make of it, and they were surprised at the rate the disease spread. Next, I asked, what are or were your concerns regarding COVID? Some themes included that they were concerned for their own health and that they were concerned for the health of others. Other responses included that it will limit visits from family, were wondering if it was treatable, and wondering if others will do their part to stop the spread. Next, I asked, how has COVID affected your life and mental health? Some themes that I found was that it increased stress from lack of communication with family. Others reported feelings of depression and isolation. Some reported feeling fear, and others reported no impact at all. Other responses included that they were unsure of what to think and that increased time alone was enjoyable. How have you been coping with the stress and changes surrounding COVID? Some themes I found was that they were doing fine. Others communicated with friends and family. Others relied on medication. Some other responses included that they are taking things one day at a time, that they are being spiritual, adapting and finding new hobbies, and others reported not doing well. Has there been any positives that have come out of your experience with COVID? Some themes included that there were no positives, or the increased sanitation and the concern for others, specifically hand washing. Other responses included that people are coming together to make a better future. Some are reminded not to take life for granted. Others stated there is an increase in public awareness about health. While none or no positives was a theme, the majority of patients had identified at least one positive experience. So the summary of my findings. Each patient had their own unique experience with COVID-19, and they offer a variety of perspectives. Most patients were concerned about their own health as well as the health of their loved ones. Many patients also report an overall increase in feelings of stress, fear, and depression. However, many patients report finding ways to cope with these feelings. And the majority of patients were able to find positives in their experience with COVID-19. I found an interesting study that took a different perspective on what a pandemic meant. According to Bridgeland, the nature of a pandemic in which the future is uncertain challenges the definition of what we consider to be trauma. Trauma is generally defined in relation to events that have happened directly to someone in the past, such as physical abuse. However, participants in the study displayed symptoms of PTSD in relation to COVID-19, whether they had been diagnosed with the disease or not. This challenges the idea that trauma must be direct. The worst reported symptom of participants was anxiety over anticipated events. This challenges the idea that trauma stress has to have occurred in the past. This study suggests that we can take a trauma-based approach in helping patients and others cope with the stress of the pandemic. Lastly, I wanted to share my experience as a student. I experienced increased level of stress and anxiety because I was afraid of how I was going to meet the requirements to graduate on time. I had to remain flexible and adaptive as classes, my job, and fieldworks changed. Some coping strategies that I found were taking walks, hiking, connecting with friends and family through social media, and much more. Lastly, I wanted to say a huge thank you to Sarah for being flexible and willing to take me on as a fieldwork student in the middle of a pandemic. Thank you so much.